Good day everyone, I'm Gian, your nurse for today. So for today, we're going to perform care for eyes and ears. So first, we need to explain to the patient or the significant others or relatives what we're going to do to our patient's eyes. So next, we need to gather our materials for our procedure and we need to perform hand hygiene. Next, we need to provide privacy to our patient. So let's start. First, you need to wear gloves. Next, we need to pour half of the kidney basin as sterile NSS. Let's assume this is the sterile NSS and this is a kidney basin. Next, gently soak the sterile OS. Then, squeeze tightly. Then, start wiping from inner to outer canthus, then upper and lower eyelids. I'll start wiping po. This is to remove the dried tears from the eye and drainage from the eye. Next, gently pull down with one finger the lower eyelid, then apply the lubricating ointment. So, let's assume this is a lubricating ointment. And make sure you should discard the first bead and apply 2 centimeters in the lower conjunctival sac. Next, pull up the upper eyelid also with one finger if artificial teardrop will be applied. Apply 2 to 3 drops or as ordered. So let's assume that this is an artificial teardrop. Make sure to put it or apply it in the lower outer third conjunctival sac. So after installation, do punctual occlusion for 30 seconds. Okay? If the patient is unable to blink, put an eye patch or place the tape on the eye patch to the eyes. Then after that, document the procedure including the time, date, name, and signature of the nurse. So unfortunately, we don't have any contact lenses for our patient. So let's assume that we have contact lenses and properly execute the procedure. So next, we need to assess the need to clean the contact lenses and explain to the patient what we're going to do today. So sir, we're going to put some contact lenses in your eyes and also perform hand hygiene using an antibacterial soap and also provide privacy to your patient. So let's start. So gently pull down the lower eyelid with one finger. Then, instruct the patient to look up and slide the lens down. And gently pinch the lens between the thumb and index finger. So, sir, please look up. I'll slide down the contact lens. Pinch the contact lens. Okay, thank you, sir. Next, Gently touch the surface of the contact lens with an index finger and make sure the lens is centered correctly in the eye. Then pull the lens away from the eye. Sir, I will pull out the lens. Okay. Next, repeat for the other eye. Pinch. Pinch with thumb and index finger. Then, away from the eye. Okay, thank you, sir. And next, with contact lens in your palm, put a few drops of hydrogen peroxide to clean and disinfect the contact lens and put it in proper container. Let's assume this is a hydrogen peroxide. So lastly, wash hands and document the procedure. So next, for the eye irrigation, we need to identify the client with 2 identifiers and explain to the patient what we're going to do today. Next, I've already gathered the materials that we're going to use for our procedure. So let's assume that this is an irrigating solution. Next, the kidney basin, gloves, clean cloth, and sterile OS. So let's start. So first, we need to wear gloves to start the procedure. So next, instruct the patient to tilt the head on the affected site area. Sir, please tilt on the affected side. Then, place the kidney basin on the affected site area to catch the outflow. Next, wash the eyelashes and eyelids with prescribed solution at a room temperature. So let's assume this is the prescribed solution. Okay, next, allow the irrigating fluid to flush down from inner canthus along the conjunctival sac. Use enough force to flush out secretions from the conjunctiva. So let's start. Next, alternately have patient close his eyes. Okay, thank you. So pat dry with OS and the patient's face with clean towel. Then, document the kind and amount of fluid used as its effectiveness. Next will be the ear irrigation. So, same procedure as the eye irrigation. So, we need to identify first the client and explain the procedure, what we're going to do to the client. And also, gather the materials for our procedure. So, first, identify and explain to the client what we're going to do today. So, sir, we're going to perform a ear irrigation. Which is the affected side, sir? Okay, thank you. Next, position the client in sitting or lying position. So, as you can see, the patient is in sitting position. So, instruct the patient to forward the head or tilt in the affected side. So, next, place the kidney basin. So let's assume that this is the kidney basin. Place the kidney basin to the patient's head under the eye of the affected area. Next, place the basin to the patient's head and under the affected ear. Then put the clean towel the side of the head. Next, test the temperature of the solution. It should be comfortable in the inner wrist area. Next, ascertain if impaction can absorb moisture. It will make the extraction difficult. Gently pull the outer ear upward for patients 3 years old above. If the patient is 3 years old below, gently pull down the ear and pull down backward. Next, place the tip of syringe or irrigating solution or irrigating catheter at the opening of the ear. And next, gently direct the stream or fluid against the sides of canal to avoid pushing inward of the impacted cerumen. And clean the excess irrigating solution. Then observe for pain and dizziness of the patient. Then dry the external ear. Then remove the soiled equipment and make the patient comfortable. Place the patient on the side lying on the irrigated side for a few minutes after the procedure to allow the remaining solution to drain. And document the time and date of irrigation, amount of solution, and effect of treatment. So next, taking care of the hearing aids. So first, we need to keep the hearing aids away from heat and moisture. So next will be the cleaning of the ear mold that may be washed daily with soap and water. So next, dry the ear mold before it is snapped to the receiver. And next, the cannula of hearing aids is cleaned with a small pipe cleaner like device. So next, check for malfunctions. Switch if on. A whistling noise or pain from the mold indication that the hearing aid is not functioning properly. So next, check if the batteries were charged and positioned correctly. If the hearing aid still does not work properly, the dealer should be notified. Then, the dealer may lend a hearing aid to patient until the repair can be accomplished. Then lastly, observe for complications on use of hearing aids. When occluded by hearing aid, the external auditory canal can become moist, otitis media, pressure ulcer in the external auditory canal.